Meniscus tear of either the medial or lateral meniscus, or both indeed, and you're wondering what do we do next? There are three main options. One is to try physiotherapy and rest and see how the tear recovers. The second is to try physiotherapy and rest and then have another review with a specialist to see whether it's healing well or whether actually the knee is getting worse and surgery may be required. And the third is to have early surgery, ideally to repair the meniscus, but sometimes to trim a flap that may be causing more damage. Now, which of these options you consider depends on many different factors. And I've been involved with the British Knee Society in looking at the evidence and drawing up a consensus guideline. There are 5 main factors. The first is, what are you like as a patient and how healthy are you? And what are the risks of managing this without surgery or managing it with surgery? The second is, how long have the symptoms been present for and what exactly are the symptoms? The third is, what's been tried before and what's worked or not worked? The fourth is, what does the knee feel like when examining the knee? And the fifth is, what does the scan look like? What is the pattern of the tear and what else is going on in the knee? So if I was a patient who had a meniscus tear, I'd be thinking, what is the collagen of my meniscus like and how likely is it to heal and what kind of stresses am I putting on that knee? I'd be putting more stress through that knee if I was doing twisting sports or high impact sports, or if my body mass index was greater than 35. In this case, the meniscus is unlikely to heal with A, without rest, and B, without losing weight. The second is, how frequent are my symptoms and what are they? So am I getting pain pretty much with every step? Is it a sharp catching pain when I twist or turn, or is it a dull ache? And does it happen frequently or is it happening once every couple of months? The third is, how long have my symptoms been present for? Is it been just a few days or has it been over 3 months? The longer the symptoms go on and the knee is not recovering, the less likely it is to recover in the first place. Okay. The next is, what has been tried to help me with my knee? Have I rested it? Have I had physiotherapy? And physiotherapy can consist of a combination of swelling management, massage, strength and range of movement exercises, and sometimes some adjunctive treatments like ultrasound. Has this helped or has the knee got worse? Finally, when the surgeon looks at your knee, what do they feel? Do they feel point tenderness when they're pressing over the meniscus? Is there a swelling in the knee? And how well is the knee moving, both in terms of straightening and bending? And the final consideration is what the scan looks like. So if it is a tear purely of the meniscus with nothing else going on, then you want to look at the tear itself. Is it a hairline tear where the meniscus has hardly moved out of position? Is it a tear in an area where there's a good blood supply? Or is it quite a substantial tear where the meniscus has moved out of position or is in a flap that is unlikely to heal? All of those factors will tell us the likelihood of the meniscus healing without surgery or whether surgery is required early. So the couple of situations when surgery is required very early is in the case of a dislocated meniscus. So the meniscus is torn and moved out of position. And this is particularly an emergency if the knee is not straightening fully. In that case, keyhole surgery, ideally to push the meniscus back and to repair it with sutures, is the ideal situation. Sometimes the meniscus is too damaged to do this and the torn portion may require removal. If your symptoms have been present for more than 3 months and you're experiencing sharp catching pain, that's another reason, especially if there is a flap of tissue, for an arthroscopy. When arthroscopy is unlikely to succeed and in most cases is not indicated, is if you have an arthritic knee where there is a lot of wear and tear in the joint surfaces and there's a meniscus tear, because it's very likely that most of your symptoms are coming from the arthritis rather than a meniscus tear, and doing a keyhole not only doesn't help the symptoms, but actually can defunction the muscles and make the pain worse. The only exceptions to this are if there is a loose body that's getting stuck between the bones, or there is a significant meniscus tear that's completely loose and out of position.